Hi, my name is Prazak. I'm a student nurse at the University of Manitoba. Today I'm going to be performing a chest tube dressing change. Before I get started, I'm just going to mention that my field of work here is below my realm of sterility. In practice, my workspace would be higher above my waist, but since my table is so low, it's going to be below my waist and technically not sterile. So I can get started here. The first thing I'm going to do, collect my supplies, wash my hands, go inside the room, do a safety check as I walk in, so make sure the patient is at the lowest setting, call bells in reach, they're not in any distress. Again, I wash my hands as I go inside, introduce myself, say hi, my name is Prazak, I'm a student nurse, I'll be working with you today. So I go to the patient's bedside and I just identify the patient, make sure it's the correct patient, ask them to state their name, first and last name, and it checks out with my documents, so this is the correct patient. And then I can kind of explain to the patient what we're doing today. So today we will be changing your chest tube dressing. I'm going to be taking the old dressing off, cleaning around the chest tube and the peri-wound skin with normal saline and some gauze. And then I'll be drying the peri-wound and the chest tube before assessing it. And then recovering it with some Gelinet, 1 piece of Gelinet, 2 drain sponges, a 4x4, and then 2 pieces of Mefix to secure it. Do you have any questions? They say no. Would you like to proceed with this? They say yes. So we can go ahead and get started. So I'm going to prepare my sterile field here. So I'm going to wash my hands and open this away from myself here. So this table is kind of small. It's a little smaller than, so my sterile field here is going to be a little smaller than it is in real life, or it would be in real life, or in practice. So I'm not going to be using this, just drop this to the side, and then have a garbage bag here. I'm just going to set this up right beside the patient here for the old dressing. Set it up right there. So I can start adding things now. So I got my sterile water or my normal saline. I'm checking to see if it's expired. It isn't, so I can just add this to my tray here. Making sure I don't drip anywhere outside my tray. Just need a little bit here. Perfect. And then I'm going to add my IV compresses or my IV drain sponges. Making sure when I wing it back that the parts I've touched don't go back onto the gauze itself there. So, it's stuck there. So it kind of grazed the corner. I was taking it off. It was still the inside of the gauze or the package. In practice, I'd probably just ask for a new package just to be sure. But I'm going to continue here. And again, same thing with the gauze. Just the gauze there, perfect. So put this here. And lastly, Gelinet. I've been reusing materials while doing this demo, so the Gelinet is outside of its little kind of casing inside the package here. So I'm just gonna put this down like so. In practice, it would be in this casing here, but for the sake of the demo, it isn't. So now I can go ahead and wash my hands. I'm going to put some clean gloves on here. So some clean gloves, and I'm going to start to take the old dressing off. And while I do so, I'm just going to secure the chest tube here. And as I take it off, I want to take note on the old dressing here for any drainage. And I don't see any, so that's a good sign. Take this off as much as possible. There we go. Drop this right in here. And then for the old Gelinet here, I'm just going to use my forceps. Take it off like this. Right on. Okay. Drop that in there. Drop the forceps in there as well. And I can take my clean gloves off here. So next thing I'm going to do is don my sterile gloves. So I'm going to come around to the other side of the table there because that's the only place I have space. So again, perform hand hygiene. I'm just going to move the patient a little bit too. Lack of space here. And just making sure I only touch on the edges here. Fold this back, it likes to fold over itself. So this, here. So I just pull up and away from myself. And then go under the cuff for this one. And pull up and away, so they're on. Good. And I can discard of this. So again, I wouldn't be dropping my hands below my waist, but since the workspace is below my waist, it's going to happen in the demo here. So now I can go ahead and begin to clean. So I'm just going to use 2x2s here. To start. Some sterile water. Alright, so I'm going to go in a circular motion here, making sure not to touch the peri wound or the chest tube with the sterile forceps there. So there's one. So I dropped that. That's okay. I can actually keep working here. I can use my sterile gloves to make the rosettes. And I'm trying not to lean over my sterile field too much here. Good. And now a little further around the peri wound. And again, not trying to lean my face over the dressing tray here. And one last swipe around the peri wound here. Again, making sure not to touch the sterile forceps to the peri wound. And now I'm just going to clean the chest tube. Same idea with the rosettes. So here I'm just going to do one swipe underneath. From the side of incision layer away. One last one here, and then I'm going to dry everything. So now we're going to go on top here. Again, one thing I forgot to mention before I started here is I'd make sure the patient is in semi-fowlers position. And if they can, raise their arm above their head. Forgot to mention that before, but that's something I would do prior to beginning cleaning here. So you can actually just use my hand straight up here. Okay, so now I can dry the peri wound. One good swipe. And I'm just going to use my sterile gloves here because I can, or my we're going to dry underneath here, just like so. And last one just on top. Then I'm going to assess the peri wound. Good, I can just go like this actually. Sounds sterile. Perfect. Okay, so now I can assess the peri wound. So I'm looking for any signs of edema, inflammation, irritation. There's no drainage, like I said before. The chest tube is well approximated to where it was inserted originally. There's no foul odor. Everything checks out here. So yeah, now I can go ahead and put the new gel net piece on. I'm just gonna grab my forceps here and just tuck this underneath the chest tube and grab it from the other side there. Good. Okay. So now I'm going to make sure that the Gelinet sits flush with the chest tube and the peri-wound there, just to seal off that opening there. So now I can discard these. So next I'm going to put on my first piece of drain sponge here. So this first one will go on this way, like so. And the next one come on through here, perfect. And one piece of 4x4 gauze will go on top of that. And then I can apply my fix here. So the first one will just mostly be to secure the dressing to the skin here. And the second one will be to tent the chest tube there, just so it gives it a little bit more stability in staying where it's supposed to be. I've dated this piece of fix here. Okay, I can go like this, just overlap here. Like so. And then with this other portion, I'm going to make sure to tent around the chest tube. Like so. It's a little folded over on the top there, but the important part is that it's tented and secured right next to the chest tube, which it is. So I see that the date there is kind of unreadable, so I'm going to sign, or I would sign the fix again. So now the dressing's done. What I'm going to do is collect my supplies, do a safety check as I leave. I'm going to make sure to document the peri-wound condition, that the chest tube was well approximated and in the correct position, or in the position it was when it was inserted, how the patient tolerated the procedure, and what was used to clean the peri-wound, what the old dressing consisted of, if there was any drainage, what the new dressing consisted of, and yeah, so that's that. So I do a safety check as I leave and head out.